Thank you for joining us for an Aegis webinar on understanding emerging substances in clinical practice. Today, we'll provide focused insights on cychlorphine, kratom alkaloids, and phenazolam. My name is Dr. Hope Randle, and I'm a member of the clinical team here at Aegis. Any information covered in this presentation is the intellectual property of Aegis Sciences Corporation. A recording of this webinar will be available for viewing after the presentation. It is our goal that by the end of this presentation, participants will be able to describe the pharmacology, clinical effects, and potential toxicities associated with cychlorphine, kratom alkaloids, and phenazolam, be able to recognize emerging trends and clinical challenges related to these substances, and finally, be able to appropriately find and utilize Aegis's many educational resources to support clinical decision-making and patient safety. We'll start today's discussion with a brief patient case. JR is a 38-year-old male with no significant past medical history who presents with new onset sedation. He is observed dozing in the waiting room prior to his appointment and is visibly having trouble staying awake. He is unable to provide a reliable medication history due to his profound sedation. His provider requests an on-site urine drug test to rule out potential substance contribution, and the point-of-care test is negative for benzodiazepines and opioids. So, what next? Today, we'll discuss what testing limitations might exist, which substances should be considered in such a case, and what resources Aegis offers to help guide clinical decision-making in scenarios such as this one. We have to start by addressing the overarching issue here, the constantly evolving drug supply. As is seen in Figure 2 at the bottom of the screen, the primary cause of U.S. overdose deaths has transitioned from prescription opioids in the 2010s to synthetic opioids, as long ago as 2015. This space has continued to change with the emergence of novel synthetic opioids and designer benzodiazepines, among other substances. These compounds may evade detection in routine drug panels, leading to false negative results and missed opportunities for clinical intervention. Additionally, there has been an increase observed in polysubstance exposure, which has been documented to elevate the risk of negative clinical outcomes, including overdose and death. The first and primary resource I want to introduce you to today is Aegis's Emerging Drug Trends webpage. This can be found under Clinical Resources on the Aegis webpage and includes important updates on emerging threats in the toxicology space. Today, we're going to spend time unpacking 3 of the recent emerging threats highlighted on this page. N-propionitrile-chlorphine, or cychlorphine, kratom alkaloids and their ongoing proliferation, and lastly, phenazolam. Our first emerging substance of the day is N-propionitrile-chlorphine, or cychlorphine. This substance is a synthetic opioid, part of the bendamidazole drug class, or easier to say, orphine drug class. It has been detected in the illicit drug supply since 2024, with significant proliferation across the United States in the last year. In April of 2026, the Office of National Drug Control Policy published a warning that cychlorphine, which is approximately 10 times more potent than fentanyl, had been involved in at least 55 deaths across the country to date. While there is limited historical literature on drugs like cychlorphine, it poses a significant threat in today's illicit market. Major concerns around exposure are linked to unpredictable potency, which may significantly increase overdose risk. Additionally, this substance is often detected alongside other opioids or designer opioids, stimulants, or benzodiazepines, which may significantly increase risks of toxicity and overdose. In the case of suspected cychlorphine overdose, multiple doses of naloxone may be required in excess of the doses required for traditional opioid overdose. The orphine drug class was initially developed in the 1970s for pharmaceutical research. While these medications were never approved for routine human use, analogs such as morphine and chlorphine began to emerge as early as 2020, These substances are thought to exhibit high binding potency at opioid receptors, proposed to be higher than that of prescription opioids in initial studies. The potency of these drugs, including cyclorphine, may be highly variable and unpredictable, contributing to their overall risk. Clinical presentation after cyclorphine exposure largely mimics that of prescription opioids, with symptoms like extreme fatigue, loss of coordination or confusion, slowed or shallow breathing, pinpoint pupils, and nausea or vomiting. Because these substances are not included in standard opioid panels, they may not be detected on traditional point of care or definitive opioid tests. Care teams should consider testing for emerging synthetic opioids in clients who may present with unexplained opioid toxidromes and negative routine testing. If you suspect a client has been exposed to this substance, be prepared to treat with additional doses of naloxone and seek immediate medical care, as respiratory depression may be life-threatening. As previously mentioned, cyclorphine has spread rapidly across the United States in the last calendar year. Since July of 2025, cyclorphine has been detected in 15 states through Aegis testing. These substances may quickly cross city and state borders, highlighting the importance of keeping up with nearby emerging trends. The second emerging substance we'll review today is really a group of substances, Kratom alkaloids. Kratom is a psychoactive botanical derived from the Mitragynine speciosa tree, indigenous to Southeast Asia. While mitragynine, the primary alkaloid in kratom, has been used for centuries in various homeopathic remedies, its newer semi-synthetic variants, 7-hydroxymitragynine or 7-OH, and mitragynine pseudoindoxyl or MP, have gained increasing popularity in recent years. Mitragynine, a moderate mu-opioid agonist, is present in the natural kratom plant. When consumed, it's metabolized in the liver to form 7-OH, which exhibits increasingly potent effects. It's then further metabolized in the blood to MP, the final and most potent metabolite. The clinical effects of kratom products are thought to be both dose and product dependent. Semi-synthetic products containing 7-OH and MP are proposed to have 10 times and 100 times the potency of traditional kratom, respectively, leading to increased risk of toxicity. High or frequent dosing of these products may lead to clinical dependence and withdrawal symptoms mirroring that of prescription opioids. Additionally, there is documented risk of liver toxicity, severe sedation, and tachycardia or hypertension. Kratom products are often detected alongside other substances, which may increase risk of overdose and life-threatening outcomes. There are a number of different challenges associated with kratom monitoring and detection. These substances are not included in many routine point-of-care or definitive testing panels, which may prevent identification. Kratom products also vary significantly in composition, continuing to evolve in order to navigate local and federal restrictions. If you are working with clients who may be taking kratom products, encourage them to regularly review the packaging and ingredients for any potential changes so they can stay up to date on associated risks. Across Aegis testing, kratom has been tested for and detected in 45 states. Kratom testing at Aegis currently includes mitragynine, 7-OH, and MP in both urine and oral fluid. As kratom alkaloids continue to evolve, it is more important than ever to keep up with what is present in your state and county. Product sale and possession is increasingly restricted, with 8 states enacting complete bans and many more passing kratom consumer protection acts, requiring age restrictions or product testing. Unfortunately, new semi-synthetic variants continue to emerge into the supply nationwide. One such compound is MGM-15, or dihydro-7-hydroxymitragynine. This new compound is proposed to be 30 times more potent than traditional kratom with regards to opioid receptor binding. This suggests the potential for increased toxicity, overdose, and dependence risk when compared to traditional kratom. Lastly, The National Institute of Health has recently greenlit an IND or investigational new drug approval for the study of mitragynine in the management of opioid use disorder. The study is intended to be a randomized, double-blind, placebo-controlled study completed at the University of Florida. Our last emerging substance of the day is Phenazolam, also known as clobromazolam. This substance is a designer benzodiazepine, first synthesized in the 1980s as a potential pharmaceutical. It was never approved for human use, but was detected in the illicit drug supply as early as 2016. Phenazolam is not currently a controlled substance in the United States, and its detection has increased steadily since 2024, often being detected alongside other illicit substances, including other designer drugs such as nitazines, orphines, medetomidine, and bromazolam. Polysubstance exposure has been established to increase risk of severe outcomes and the potential for overdose. As with many of our other novel psychoactive substances, there's very limited available literature around phenazolam. However, one study did demonstrate significant potency that may far exceed that of many existing prescription and synthetic benzodiazepines. As seen with other designer benzodiazepines, phenazolam may present in counterfeit prescription pills such as the one on the right side of your screen. This counterfeit Xanax pill was confiscated in Australia and found to contain bromazolam and clobromazolam, or phenazolam, in early 2025. As dose and concentration can vary significantly between batches, there's a significant concern for overdose and severe outcomes associated with this substance. Clinical presentation may include prolonged sedation, slowed movement or speech, reduction in respiratory rate, and delayed clinical recovery. Phenazolam is not likely to cross-react with traditional benzodiazepine point-of-care tests or definitive testing, highlighting the importance of broad definitive testing in clients whose clinical picture may not match up with their point-of-care results or initial definitive benzodiazepine results. Across Aegis testing, phenazolam has been tested for and detected in 37 states since July of 2025. The prevalence of this substance, which is little talked about in the national news, highlights the importance of comprehensive and detailed testing, especially in clients who may have clinical presentations that are incongruous with traditional drug testing results. There are a number of great resources available for you to use specific to emerging substances. On the Aegis website, you can find clinical updates and newsletters, educational webinars such as this one, emerging drug trend updates, and our clinical reference chapters. Our clinical team is always available and happy to provide education around these topics as well. And you can always find us on LinkedIn with weekly updates on what's new in the toxicology and substance use space. We'll wrap up our time together by revisiting our patient case. As a reminder, JR is a 38-year-old male presenting to his primary care clinic for a routine checkup. He is visibly impaired, but his point-of-care urine drug screen is negative for all substances. From the information we've reviewed together today, we can conclude that testing limitations do exist, as menus are often limited to common drugs or classes and may not be inclusive of novel substances. We can conclude that other synthetic and semi-synthetic substances should be considered in cases such as JR's, and that Aegis has many publicly available resources that can help you navigate challenging cases such as this one. In summary, we hope that today's webinar leaves you with the following takeaways. Emerging substances continue to complicate clinical toxicology interpretation. Cychlorphine, Kratom alkaloids, and phenazolam each present unique risks and detection challenges in the clinical population. Polysubstance exposure remains common and increases risk to patients. Awareness of point-of-care testing limitations is critical to patient safety and outcomes. And last but not least, Aegis's educational resources are easily available and can help support clinical decision-making. Thank you so much for your time today and for joining us for this educational webinar. Our clinical team can be reached at the number and email on the screen. Have a wonderful day.